Your spine is under attack right now, and if you've already tried physical therapy, medication, and chiropractic care with zero lasting relief, your pain has officially crossed into refractory territory. That means your nervous system has rewired itself to keep firing pain signals even when the original injury is long gone. But here's what nobody told you. There are advanced techniques specifically designed for exactly this situation. Welcome back. Today we're going deep into something that most pain videos never cover. What to do when nothing works. We're talking about advanced interventional techniques for stubborn, persistent spinal pain that just won't quit. By the end of this video, you'll understand why your pain has lasted this long, what options exist beyond the basics, and how to build a real long-term strategy to get your life back. Let's get into it. Your spine is one of the most complex structures in your entire body. It's not just bones. It's a living system of discs, nerves, joints, muscles, and ligaments, all working together every single second of your day. When one part breaks down, everything connected to it starts to suffer. Discs bulge and press on nerves. Joints get inflamed. Muscles lock up to protect damaged tissue. And the longer this goes on, the more your nervous system adapts. Not in a good way. It actually becomes hypersensitive, continuing to blast pain signals to your brain long after the original damage is healed. That's the cruel reality of chronic spinal pain. It stops being just a physical problem and becomes a neurological one. Understanding this is honestly the most important step toward finding relief because it changes everything about how your pain needs to be treated. So you've done the exercises. You've tried the medications. Maybe you've even gone through months of physical therapy. And the pain is still there every single morning when you wake up, every single night when you try to sleep. This is what doctors call refractory spinal pain, and it affects far more people than most healthcare providers openly discuss. The reasons it persists are genuinely complex. Sometimes the original diagnosis missed a secondary cause. Sometimes multiple issues are happening simultaneously. A bulging disc and an inflamed facet joint and a compressed nerve all at once. And sometimes, as we just talked about, the pain pathways themselves have become the problem. The good news? Recognizing that your pain is refractory isn't a dead end. It's actually a turning point because it opens the door to a whole category of targeted, precision-based treatments that conventional care simply doesn't offer. Here's where things get genuinely exciting. Advanced interventional techniques are precision tools. Think of them as the difference between watering your entire garden and using a targeted drip system on one specific plant that's struggling. These procedures use real-time image guidance, X-ray, ultrasound, sometimes MRI, to deliver treatment with pinpoint accuracy directly to the source of your pain. Some techniques deliver anti-inflammatory medication right into an irritated joint or nerve root. Others work by interrupting the electrical signals that pain-generating nerves send to your brain, essentially turning down the volume on your pain. Others still are designed to stimulate your body's own healing response in damaged spinal structures. Most of these procedures are minimally invasive, meaning no large incisions, no lengthy hospital stays, and often same-day discharge. They are not magic cures, but when combined with the right rehabilitation plan, they can be genuinely life-changing. Here's the truth that every good pain specialist will tell you. No single procedure, no matter how advanced, is a finish line. The most successful outcomes happen when interventional techniques are paired with an active, ongoing recovery strategy. That means targeted physical therapy to rebuild the core muscles that support your spine. It means improving your posture and ergonomics, making sure your workspace, your chair, and how you lift and carry things aren't quietly undoing all your progress. It means staying hydrated so your spinal discs stay flexible, managing stress because muscle tension is a massive pain amplifier, and genuinely listening to your body's early warning signals before small discomfort becomes a serious flare. Movement is medicine, gentle, consistent, appropriate movement. Activities like walking, swimming, and yoga have real evidence behind them for spinal health. Your body wants to heal. Your job is to create the conditions that let it. If any of this resonated with you today, do me a favor, hit that like button. It genuinely helps this channel reach more people who are suffering and searching for real answers. Subscribe so you don't miss our next video on specific spinal exercises for chronic pain relief. And drop a comment below telling me how long you've been dealing with spinal pain. I read every single one. Also, if you're managing pain flare-ups at home, the heat and cold therapy product I recommend is linked in the description below. You are not stuck, and your pain does not have to define your future. There is a path forward. It just requires the right information, the right team, and your own determination to take that first step. As always, consult your doctor before starting any new health routine.